Hi, my name is Makanjariso from Mali and my teammate is Joseph Oyotunde from Nigeria. We're arguing as the negative team of Group 3. Our topic is titled, Should African Nations Make Genetic Counseling Services Free and Accessible to Reduce Stigma Associated with Genetic Disorder? We'll introduce that genetic and genomic counseling services help people understand genetic risk to interpret test results and also make informed decisions, by the way. So these services bridge medical genetics with personalized support, which evolved from traditional genetic counseling to broader genomic applications amid advances in sequencing technology. As negative team, we will say that making genetic counseling universally free and accessible may not be the most practical or sustainable solution in our countries, given that the diverse healthcare needs, the resource concerns, and the infrastructure challenges that many of them are facing. So to effectively reduce stigma around genetic health, we should prioritize context-sensitive, community-driven, and genetic counseling initiatives that account for practical, economic, and cultural realities. So this approach will enable us to build sustainable and culturally relevant health systems that truly support the affected people by genetic conditions. So as the economic constraints, our nations face severe budget limitations. Many of them allocate less than 10% of their GDP to total healthcare, which is far below the average. So granting free genetic counseling sometimes requires also training and hiring counselors, setting up clinics, and funding durable programs. So this diverts funds from life-saving services. So rather than universal free access, we better align ourselves with fiscal realities in low-resource settings like Mali in West Africa. As constant, we also have limitations in terms of infrastructure and expertise. Most of our countries face lack of geneticists and advanced labs for testing and data privacy frameworks. So only few of them have certified genetic counselors, and genomic infrastructure is not nascent outside South Africa and Nigeria. Making them counseling free and accessible may not be realistic when we face workforce shortage. So limited infrastructure and expertise as an aspect in the rural area also is about lack of diagnostic labs, referral pathways, trained personnel, consistent internet, and making free making services free without infrastructure will not be translated into true realities. So the cultural aspect also in terms of limitation from which genetic disorder stems from, like traditional beliefs, social norms, kinship structures, spiritual attributions. As an example, the high consanguinity, about 27% in Mali, boasts recessive diseases but foster secrecy and avoidance of testing due to confidentiality fears. So counseling alone cannot shift deep-seated taboos without community-led education, integrating local leaders and faith. As rebuttal, Mali's research ecosystem, like most of our countries, heavily depends on foreign funding. So, making blanket fiscally untenable amid political instability and low-cost revenues. The HC Africa Funds is an example in Nigeria and Mali in West Africa. So, while funding in a competitive way, like Top 10 Mali, have shown success, relying only on such approaches for genetic counseling may exacerbate existing health disparities. So in our continent, many lack access to basic health care. Prioritizing services that requires significant investment in genetic testing and counseling may divert resources from more pressing health needs like malaria and HIV. So this will ultimately widen the gap between people having access and those that do not have access. So making counseling free and accessible may not be realistic with the workforce shortage we are facing in many of our countries. So throwing more resources into scalable training, the tech integration, and fast implementation will surely not magically fix the capacity gap. Knowing that investing in solution is also crucial, we should be aware also of that the absence of counselors in low resources setting is a glaring gap that cannot be ignored. So without trained counselors, equitable access to genomics remains a pipe dream. Our policy priorities must translate to tangible actions, not just rhetorics. So technology can also enhance access, but we cannot rely only on telehealth and virtual platforms. This will overlook the critical need for robust community-based infrastructure. So in many areas, we lack of internet. The first lack of internet, digital literacy, and reliable electricity hinders effective use of these tools. So investing in physical setups and community health workers is equally crucial to marginalized population and ensure equitable access to genetic counseling services. The UNESCO program in Mali showed a success, but this success does not justify that we can make genetic counseling universally free. Why? Because the program's target approach and specific context cannot be replicated nationwide without significant resources. Instead of blanket policies, we should focus ourselves on scaling proven models and explore cost-effective solutions that balance accessibility with sustainability. So we conclude that our nations should refrain from mandating free and universally accessible genetic counseling because those measures risk overburdening fragile health systems, diluting cultural resilience against stigma through imposed Western models. Also, they divert scarce resources from more pressing public health crises, which ultimately fail to sustainably empower community beyond superficial knowledge gains. We thank you all for your kind attentions. If you have questions, they are welcome.